God. Do it as though there is no tomorrow. Number 2, what you have is an opportunity given to you but denied to me. Do it with all your heart, love, and compassion. Number 3, and that you know me for that do good for our patients. When you do good for our patients, goodness will not only follow you, but chase you. Your Excellency, we are a baby for you. We are level 4. We want to grow to a level 5. But a few things that we need you to do for us. One is develop that radiology block and finish it for us to house the radiology X-rays and CT scan and MRI. That will be good for our facility and will help the people of Kangundo and its environs. We also are requesting you to equip our ICU unit and as well as build a HDU for us, that is high dependency unit. Again, our patients here, as you saw this morning, they are suffering from chronic kidney disease. We would want to have a renal unit in our facility. For that matter, we want to conclude by saying, Your Excellency, we've seen a lot of change in our facility in your tenure. And we know that with your hard work and your consideration and love for Kangundo Level 4 Hospital and then virals, you're going to do that for us. We wish you good health and blessings so that you are able to continue to do other better things for us. Thank you so much.
And now, I would like to invite His Excellency, the Deputy Governor, to give his remarks and invite Our Excellency the Governor to talk to us. Thank you very much.
Ndambũka Kangundo mwazio. Monene kwena wana ndo nene atiwa. Lakini monde diere ro ni Safaricom. Na ngaba noga. Mundu wa ndaya yake namo. Ende nakumbe kuina ndo Safaricom. Lakini ngwezo motaliza kiwanza sasa hiyo mwingine ana manga huko. Sisi vitu angefanya wakati alikuwa huko. Ndio saa hii aseme niwekeni ndio muone mambo sasa. Lakini hizo itezo kunia kwa. Your Excellency, allow me to introduce your sorry kwa muziki hiyo. Kuna municipalities yenu ya Kangundo na Tala. Manager ako hapa. Kuwait tu peke yake.
Good morning.
Good morning. Haya
Ni Justice Kitengo, municipal manager.
Asante. Kuna mwenyekiti ndio huyo ako hapa bwana Antanas. Si ndio? Antanas Asante sana na nimeambiwa nani mwingine I think imefika hapo. Bosi akiwa hiyo iko sawa. So allow me to invite the key partners who have enabled us to be here today, and then I will invite the boss.
Good morning. Ndambũka Kangundo muyaseo. Eka Safaricom na ilovito ba. Tuwakamba. Tiwo muyaseo. Na kwa ni museo neta wakambo wa mutwa. Ngavana mambese nondo kuito ndiko Kangundo. Na mwetu asiyewe ba. Ba Kangundo. Kwa utendo tanu monene nondo monde nitwoka ba nikenda tunengane maternity ward inonza kwa community nikendenda na hoteli andu maitu maku Kangundo twitha tukwatanite na Ngavana ndapoma na utongo wa masaku ta Safaricom nikenda tutonye kwete maendeleo isione na ndoa ne sito kwa huo monde tena ndo kadhaa Safaricom na no Mungu enda amoke moko mebala mai kama kuna mtu wa Safaricom mali yuko pande tuanywe mkono tuko nao ni kwa sababu ya muda hawataongea. Nitamuita tu mmoja wetu ambaye anaitwa Henry awasalimie, kisha baadaye nitamwalika ambaye ameongoza kikundi cha Safaricom aweze kutoa hotuba yake.
Your Excellency, Honorable Wavinya Your Excellency, the Deputy Governor, all protocols observed. Siana sianga imu yaseo. Muyaseo ingi. Kwitu ne mboni na kuone Kangundo. Mboni kuyima, Kangundo kuyima, na nduma mboni masya. Ko yai kwa nduma Kangundo. Anduma Kangundo muyaseo. Kaina muadime. Amen.
Okay. Usune we munane wa foundation kwa Safaricom M-Pesa Foundation hii na ni wetu kwatanete na keke ndatu wete sindo hisi ondemo kwa na tuetete ko nya kwa eko yaba ya mukuneke noka hisi vitale wa mukuneke wethe wa wewa owa Kangundo na kauno monini. Let's now at this juncture invite James Mutisia, who is in charge of the Safaricom delegation for this event, so that he can make the remarks on behalf of Safaricom.
Thank you, Jackson, Kilonzo, Excellency Wavinya Ndeti. Anduma Kangundo ekaine mukelie. Muyaseo? Muyaseo ingi? Yundu mwewanita mutiti wa mutisia. Nimu mwana wenu. Zietwe Bangoda. Ateiye. Walinzi emai. Koi yaku wathi akabi. Tunga muziki. Na ndomako. Hey. So tioki oba mu the no mwena tembe aba na nona be bata. Na nasi okakuya na nena na mutumete wa Kilonzo. Leo nena na kendo ne wa imbesa. Ina mu ya be bata. Itale wa Kangundo. Now first, before I start my official speech, I thank Excellency Wavinya Ndeti for allowing us to partner with you. Tondukele la Safaricom twaendie kwa ofisi wa Ngavana tukasende tuenda hotel ya hospitali wakasendenda partnership yetu na county. We will not have done this job. So asante sana. Na yuno Kilonzo asya nombika tusome speech. Allow me to speak to now, read the official speech from Safaricom. And then get no longer me Zia Weber, Dali New, Mount Wangi, Dali New. Okay, Your Excellency, Honorable Wavinya Ndeti, Governor of Machakos County, the Deputy Governor, Honorable Francis Mwangangi, our regional business lead for Machakos County, who is the host here, not Machakos actually. It's what we call Southeastern and Coast region, who spoke and said this from here. Jackson Mutua, Kilonzo, head of foundation, M-Pesa Foundation, our colleagues, leadership from the county, the nursing officer in charge, and all the other leadership, the chairman of the hospital, and all other invited guests, ladies and gentlemen, allow me to begin by expressing our sincere appreciation for the support extended to us by Our Excellency the Governor and the County Government of Machakos for warmly welcoming us, partnering with us in transforming lives of the Kangundo people through this healthcare that we are handing over today. Asante sana, Governor, for allowing us to partner with you. At Safaricom, we believe that our social license to operate is built on strong partnerships with leadership, the creation of conducive environment for growth, and a shared commitment to community development. Our presence here today goes beyond the buildings and equipment that we are handing over today. It is about transforming lives and creating hope for the residents of Kangundo and Machakos County in general and the surrounding communities. It is often said that people may forget what you said and even what you did, but they will never forget how you made them feel. And that was touching when we walked in there and we saw expected mothers, the smiling faces, and the comfort. As an organization, we are guided by the United Nations Sustainable Development Goals, particularly SDG number 3, which calls for ensuring healthy lives and promoting well-being for all. Through M-Pesa Foundation, we invest in initiatives. We invest in initiatives that improve the quality of life in the areas of health, education, economic empowerment, and environmental conservation. Oh, just a minute. In healthcare, our commitment is to address the 3 critical delays that contribute to maternal and infant mortality. Delays in seeking care, reaching care, and receiving care. Through strategic investments, such as this maternity wing that has been funded by M-Pesa Foundation, we seek to reduce maternal and infant deaths and improve healthcare outcomes. And it was my happiness and our happiness to hear the testimony from the medical officers in charge that actually it's already working and maternal and infant mortality has been reduced. Why are we doing this as Safaricom and as M-Pesa Foundation? First, because the success of our business means little if the communities we serve continue to struggle. We cannot claim to be successful if residents of Kangundo and Machakos County in general lack access to quality healthcare services. Second, healthy communities are prosperous communities. When people have access to reliable and quality healthcare, children attend schools, and Governor talked that consistently. Parents go to work. Governor also talked about that. I think that's where she says the slogan. Good health is therefore a key driver of socio-economic development. Number 4, and perhaps the most important, maternal health is the foundation of life itself. Every life begins at birth. This is why the M-Pesa Foundation continues to invest heavily in reproductive, maternal, newborn, child, and adolescent health programs. Our aspiration is to significantly reduce maternal and infant mortality and contribute towards achieving near zero preventable deaths. This is what brings us here today to celebrate improved access to quality maternal and child health care services that will lead to better outcomes for mothers, newborns, and families. We are confident that this facility will enable women to access safe delivery services, quality antenatal and postnatal care, and essential newborn services. It marks the beginning of a new chapter for this community, one where health is closer, referral distances are reduced, and lives are saved. To further strengthen the healthcare access across Machakos County, I am also pleased to share that projects at Athi River Level 4 Hospital. Governor, you mentioned also you had asked for Masinga Level 4, that is also been approved. In addition to that, we have Kimiti Level 4. We have Tulia Dispensary. And we have Masewani Dispensary. Thank you. And not to mention, Governor, we haven't come to your office. There is a planned medical camp at Tala Market. That is planned for end of July. So we are coming to your office. Yes. Yeah, just to make sure that our people also get diagnosed from issues to do with cancer, diabetes, high blood pressure, fistula, and many other benefits that we get for free, 100% free. if the governor will allow us.
Of course.
And outside the health side, it's also good to mention, because you talked about also partnering in education. Kadidiama Senior Secondary School has also been given 10 million by the foundation. A state-of-the-art computer lab. I think we are looking forward to returning to celebrate these milestones and witness the continued reduction of maternal and infant mortality rates. As I conclude, I would like to make a humble appeal to all stakeholders, to the county government, to kindly continue supporting these facilities through adequate staffing, maintenance, and operational support to ensure they effectively serve the communities. Because hospitals and healthcare are not about the machines and the building. It's about the services that we are going to give. It's about the workers. And Governor, I'm confident from the stories you've given that will happen. We encourage you to take ownership of these facilities and preserve them for the future generations. Together, we can build healthier communities and create lasting legacy of care, dignity, and opportunity. Gai, amo adime, mono, adomaka, mono.
Sasa, yuni mwete munene hindi. Lakini nilo nambo mwete ya hii. You can imagine Safaricom imetuma the most senior wote tuko na wao hapa. Sindio? Alafu foundation yote, the executive yote iko hapa. Sindio? Na gavana serikali yote ya kaunti iko hapa. Sindio? Sio ni mambo mzuri? Your Excellency, I want to thank you for two things. One is mtu ni historia. Sindio? Mtu ni nini? Historia. Na mwacha mila ni? Mtuma. At least our foundation wale wakamba wako hapa mnasikia wanajua Kikamba. Yes. Sindio? Yes. Hata governor anajua. Yes. Sindio? Yes. Sasa, when governor you are up there as an assistant minister and the other one alikuwa nyumba kubwa, hiyo miaka yote mlikuwa huko, we can account for you. The other one we cannot account. Ni kweli si kweli? Munaona ama muoni? So Safaricom, Mungu awanjalie mkoe an international global top communication company. Na gavana wetu Mungu akujalie maisha mema. What Safaricom and Ngavana Wavinya have done here today is life changing. Na jamani, I wish tungekuwa tuna involve ourselves to such programs, healthcare, education, kwa sababu hapo ndio barabara iko. Kwani Safaricom imekuwa saa hii? Hapana. Si imekuwa huko? Sasa hiyo mtu tufunze Kikamba ndio tufunze hii mambo mengine ama namna gani? Si ndio? Na haya anaongea juu ya mama. No tu kwa tunakuwa hata lini. Lakini akaine bige fundi kanene sendo ninge. Safaricom boss ataongea, mimi sitaki kuunguza hapo. Lakini on behalf na wale tumeandamana na gavana, sisi tunasema asante sana, lakini boss usisikize asante yangu, boss ndiye atasema. So yuni endao mwea peo ketumi kwembwa na Ngavana Wavinya yendi muona hata mundu muka mundu tamusa kuyeta ndongo na ethi twe ndongo akatsa kuwata mumbunge akakina ume mumbunge akembwa na mbemwe Kenya ningitiwa nyako inye na ni World Bank yaise ko inye taembwa yitaeka ninya ngwazia nimba muyaze ningitoka ya munene wako kwa unondu desibitale iwe nondu desibitale na siana sito ba ila si Safaricom nimekiene zamana Ngavana Wavinya bitikeli ndikakune pelepele mwinge lakini toka ba kwa tuta it's a serious business kaundi ya mazako teikwate weyozu tikaza kuandu manza tiwo tikaza kuandu manza kwani Kaunti haina wanaume na wanawake wanatosha. Ani mundu makanda au tu abuna kilungu la guo ndoka ndambia wa bahama zako. Ngavana Wavinya, asante sana. Most of these sons following you here and the daughters are from here. Sons and daughters are from this matanga. Hizo likazia zani tutaonana. Na kesho niko na wao mahali nakutana na wao. Bana. Sio kwa hiyo kaine bikebu na ndieta munene siendo ile uili kasuala wasa kuota governor elect siendo ile obubueta ngaine weze ndinene apa Kangundo hospital nani misa kwa jandi nena relationship na ngaiwa kwa nena kila chagu healthcare and our vocational training centers, they were literally dead. And you have done within the 3 years you have been there, we can see some things functioning. I'm just cautioning politicians wale tunatafuta kura to heshimu mahospitali zetu, tuache kupeleka siasa huko. Ikiwa uko na issue, pelekea gavana, waziri yako hapa, wizara iko hapa, naenda safari kwa muongee tuone umeleta mradi kama huu. Si kuja kuleta siasa huko ndio kwa sababu you want to be elected. Si ndio? Yeah. Your Excellency, karibu, talk to us please.
Mwitayari kuma kwa gavana. Kuyumba titi kuma kwa gavana. Gavana tauyu. Gavana tauyu. Gaidi munene. Atumatumona. Gaidi munene. Atumatumona. Your Excellency.
Thank you so much. The Deputy Governor, His Excellency Francis Mwangangi, Senior Manager, M-Pesa Foundation Program, Dr. Henry Kilonzo, Regional Business Lead, Nairobi Metropolitan, Jackson Mutua, Regional Business Lead, Coast Region, James Mutisia, CCM, Health, Justice Kasivu, representatives of Safaricom, PLC, and the M-Pesa Foundation, the hospital administration, our dedicated health workers, community health promoters, distinguished development partners, the gallant residents of Kangundo. Sub-county. Theatre not to solve it, baba. The way say tene anumananda ku cooperation. Theatre ngitiki and wala operation. Ila toki yetu anena na Safaricom. twasiane tumbe na theater ya chao ya maternity ukethia ibeti ila siokosia through cesarean nisia kata nisia operate waba kiuti kendo keseo maundo ni kuevanga. Furthermore, we have fully stocked this facility with essential maternal and newborn medicines, ensuring that our mothers receive safe, dignified, and quality care through pregnancy, childbirth, and postnatal period. I am incredibly proud to report that since this unit became operational, it has already served 2,362 patients, facilitating 2,016 safe deliveries. Beyond childbirth, this unit has also provided crucial, compassionate care to survivors of gender-based violence, standing as a sanctuary of healing for the vulnerable. Chomusi bi andwa membe we na madina ko ya musi mundu asia kubuwa kuikata ayo mesi atio lazima toka musisia ndakenuke athi musiate mumeu nenge ndio mama na baba ndio niandike tena mneno hospitali no ndio mama na ndena daktari sio mama kwatie kwa uba amwe asove litakwatiania atumia na imwana ivetisia nyine chao nzove. As we celebrate this physical infrastructure, we must honor the human infrastructure driving our health sector. I want to specifically recognize our community health promoters, CHPs. Community health promoters. Hawa ndio wanatuletea watu hapa. They go in all the homes to find out what issues are there. If somebody is sick or they are about to give birth, or they are pregnant, wanawaelezea zile vitu wako supposed, the clinics, they should be coming, they bring them here, so they do a lot of work. Not even pregnant mothers, even those people who are sick at home, they are able to bring them to the hospital, they direct them to the hospital. Asanteni sana kwa kazi mzuri. Tenda wema, Mungu akubariki na uende zako. Through our relentless house visits, grassroots health education, early identification of expectant mothers, timely referrals, and diligent follow-ups, you have significantly increased the utilization of our maternal services. You are the frontline defenders of our community health, and your standing contribution is deeply appreciated. Asante sana. As your governor, my administration's blueprint for progress is built on foundational promises: absolute prudence, transparency, strict accountability in the management of public resources. Najua la safari kwa manoki baba. Andu moka makoko dhinyo majiwa tuike nena ameye kila ngwenda bala mwene chao ni sibitali, and I want to thank you that. Mundu wakombete akindu ina ilo mudhini anasiendu inge dia ilo mwasa na moko ele onasiendu isinge maasi amenda kuika. Okay, you have my support, 200% support. Na 1000 support hiyo. We are not, I've said that, through the institutional reforms and the sealing of historical revenue leakages, we have transformed our health sector. From 30 million in 2022-2023 financial year to 235 million in 2023-2024. From there, 2024-2025, we went to 775 million. And as we speak today, we are at 1.6 billion. Besa isue inaenda hapa. Itakwatiania. Mwaka wa mbele no kieta governor takola nile milioni 30. Naona baba yangu chengwa. Nege ya computerization. Tauma milioni 30, 20 milioni. 12 milioni manali na miongo 3 na chao na 5 nitakwatania tauma bau mwaka wa katatu nathi milioni maana mwanza na 5 mwaka uyu tuvinga ni na 1.6 billion na nicho mukona services zitu sikiti hata siende doctors sia kwa nurses sia kwa mena chao mena u nono na kwa kila na meyenga meka no lazima niki hata niki membwe me comfortable one nyu mbwa mwi chao mwi comfortable ga mo masovia mai mozovia nitakwatania ladies and gentlemen, this revenue is not a metric of profit but a measure of trust. Every cent of these resources is being systematically invested back to our healthcare systems in procuring medicine, maintaining advanced equipment, and expanding facilities and hiring staff. My administration maintains a zero tolerance policy towards the management of public funds. We will continue to safeguard your resources to guarantee that healthcare remains accessible, affordable, available, and of the highest quality at all levels of care. A modern facility is only as good as the hands that run it. To match our aggressive infrastructural expansion, my administration has currently prioritized the motivation and growth of our human capital. To this end, we have promoted 840 health staff members and recruited 518 new personnel. Furthermore, to fully optimize newly expanded facilities like this one, we are actively onboarding more professionals. Just this week, we advertised 321 new positions across the medical care, medical cadres. I strongly urge qualified residents of Machakos County to step forward and apply for these opportunities to serve their community. Nimewene advice hizi mawea. Sisi ana situ hizo meota kitali. Ume ni mali meke hata. Nani akikiasia siana isi andwa kuma kila sub county na kila ward. Mawea su mali oso ni siana situ nita kwati ania. Na nimbe the nengo no. Tio mweze ndingwe. Tio molili kana ndo manandi ka kumanza. Siana situ ikatiwa ite chao. Maondo asiye mabendukie. Pio. Nila kwati ania? Asiye ipio. Chainocha. Canada. Ladies and gentlemen, our achievements have been greatly accelerated by the partners who believe in our vision. I extend my profound gratitude to Safaricom and M-Pesa Foundation for their enduring support. Asanteni sana. Since 2003, the M-Pesa Foundation has been a foundational pillar for development in Machakos County, funding 186 projects that have directly changed the lives of over 416,000 of our citizens, with an approximate total investment of 848 million. Nita wadi ania? Ni mumbelo? Ni mwai? Iwe? Mundu mwana atu mwanzai? Umalazi ya mali nzaka no enda umanda sindu wetete musi. These are the sons of the soil. These are the sons of our soil. Na ni matroni si example nzio. Ona wizu kumando alangi mundu ndola wani chao. Nikwo na nena na vyo nena na mama ambeye mama nitwisi ivyo nde tumete ko ona nena maituko ya no mesi no sio mundu akeka kila mundu kila no sio mundu akeka kindu wala wikiti hata umete Ini siana situnzio mbitikele hiyo meto nundu imeaza ko ni mama wenyu. Ini siana nazi siana situnzio. Isi aitwa ni beti na umema kamba. Yadi kwa ya tubi kwa ya tukaiza hata ibese tutete musi. Twa mwezi ndo mwana tatwa smart mako kwe kale ndo meka. Nzie mameka hata. Moa kabina maye aba. Maye akithekani ama inaye atubi kithekani. Na imeze chao. Musi na imeze kekamba. Na maji esindu chao. Na ya mwadhime na yadi mamesi yenyu na yadi Safaricom. In the health sector, M-Pesa Foundation has injected 138.5 million, including 70 million modern 2-story maternity unit in Athi River level 4 and 65 million maternity unit at Masinga level 4. The facility we are handing over today. In the education sector, M-Pesa Foundation has invested 627.5 million, providing transformative learning environment alongside full scholarship of 25 bright students from Machakos at prestigious M-Pesa Foundation. Kaya mwadime. Timundu kwanda kwikala meza ni uatezi ni muombelewa indi. Baate nasianu. Ni muombelewa? Timeka bembe. Ana seo. On education empowerment. On economic empowerment, 17.3 million has been invested to uplift livelihoods across our sub-counties. This is the power of synergy between committed government and a visionary private sector partner. As we look to the future, we are building a Machakos where no family is devastated by preventable health crisis. The success of this unit proves that when we invest wisely, manage transparently, and empower our communities, we directly elevate the well-being of our people. It is now my singular honor and pride and privilege to officially declare the expanded Kangundo Level 4 Hospital Maternity Wing open and fully operational. I encourage all our mothers, families, neighbors to utilize this top-tier service fully. Together, let us continue building a healthier, wealthier, and more prosperous Machakos County. Thank you very much. God bless you. God bless Machakos. God bless Kenya. Siana isi tu yatu kaneza. Aume ama ito ni mwa ume. Aume ni mama yaba. Aume ni mama weba. Aume ni ndamo kaneza. Aume ni mama yaba. Ni mwana aume. Ni mochao. Kaya mwadime mundu ndola waneko ono ithukumaba ono yika ono isindile ngitali kangila kuya kwa nyumu sino kwenda utali kilwa ni chao nikendo na no investment no Safaricom yekie ti investment nini na ni mwewe sindile na mutalela sio the Safaricom itukite masako ati partners asio baba ndia sio zetu tume ya Safaricom ulote la inwa Safaricom ogele goko Iyo lete ma Safaricom wala wisi namba ya kwa Safaricom no Dabie niwete Ndabie namba ya kwa Safaricom Mbie Simone no lo misi andabie I give you. Ola Wewe zinamba ya safari kwa mno. Haya huko ndabie.
Oga. Wacha kuje. Kuja hapa.
0726 068
Wewe zinamba yako? 0726 068 311. Ya jao.
Safaricom.
Wa udiye to support. Ili nitatu ninanga ndo alato wena. Na tatu tisawa. Wawe andwala ma tukwata kwako tiyalo makwata kwako. Itisia na sito. Teka leva unike na matu itisia siendo. Tika manenga nani mundu akathia kilingola ake. Ati kilenga maito. Na no lazima manenga. No lazima tika thia chao. Kilenga wa chao. Thank you. Waito. Wewe wamwe mundu ala matwika. Wa makoni imoko. Safaricom, we really appreciate Safaricom and Pesa Foundation. We appreciate what you're doing for us. We don't take it for granted. And I want to assure you, whatever you need from Machakos County, we will be able to facilitate. Kila chonde mukenda hivi, ni support wa even the medical camp will be there. Even our doctors, whatever you want from us, we will provide. Sawa. Ni Mungu anainisia bila msione Mungu kwenda kuma kicho. Ile nitokwe kata. Nitokwe kata. Sawa. Na mwingine mwana issue. Minister wa Malelo no. Kila tena ino la mwenda masabu. Kila kwa jani. Wow, ni mbaya. Kaya mwadime. Thank you very much.
Aya. Alabwe. Mbutukizie. Upange ngavana liketa ba. Mwegwa.
Aya, sorry, kuna vitu kuna vitu nimeulizwa, chama na ameongea maneno ya ofisi ile ya IBC iko hapa. Tutaongea na wao tuone kama tunaweza kuwapeleka mahali pengine watoke kwa ofisi, si ndio? We will engage IBC, we will talk to them because an hospital facility should be an hospital facility and you have other places where we can accommodate them. Kwa hivyo tutaongea na wao hiyo tufanye. Kila kingi mumeitisha Reno unit. But what I can say, yes, we don't need more land here. We need to bring down the old structure and go up. So any building now we are going to build in Kangundo, level 4. Tiambata chao? Tiambata yolo. Ilangu tuibunzie. Tutakwati ania. Nikenda tuake block. Itonya kwa accommodate chao. Andwa inge. Tisawa. Kila kingine wati yesu ya dialysis. Tuamina kwa aka dialysis mukate wa baba. Tuamina sibitali langu endo tuike vya level 5. Ne Matu na Kangundo. Kwa radiology block no ye baba na mina chairman na team yaku nitogwete nini equipment on a CT scan nene se yumo ke yoka masako lakini tu abono nienda amwete yezindo nzeo ando ala modi masako me kuitwa kana maiko itwa kana ina porojo elisi anumasi yasa niwe sio mudi onoka dia agaka ndio ko senda wemwe ni mumbelewa lakini kilangu ya daktari ama kwa mamu tabie wenda wawisi aba level 5 ukamonengwa sorry level 4 tiba ukamonengwa nunda kitalo udhima kanenga nenda wesi ndeba kila maili okuya isu inenge waba masako belo di level 2 level 2 tio mwezi no ela first aid mundo nenga we benda wengi mundo tanenge wa chao lakini ila repeat prescription lasi ya daktari mwandika wake ngwesi ya pressure kembwesi ya diabetes isi netweka hata tunetwe nasio na tenenga nene nandi ena senga inge no na nene mainyo na this yo hospital ni mama level chao level 3 kwa uya kaini putani ni nywa nene ndio mulenga ta uya kaini mubange mekuma mekata nene bani mudhukume nikenda tubendwe maisha nimoni kana ndio kama ya mocha ningamona nio ndikagene ni kwa sovia kana kwa yaso atuku mmaitwa alama tudambia sisi hospitali ngaya mwadhibi anongo mwana chemba nundu mwando asio nitakwate ania kwa hiyo kuna kitu kile nimesahau HDU, that one we are supposed to do almost immediately, yeah? Yeah? Yeah. So, nina HDU, nimunambisia noka, kila weka yuyu, nikuthoa miyo, nikenda nisaubi ICU na HDU. Na kau nike kwikata. Tisawa? Nundu ona kwa nongwenda mwikale nduthi eno. Ondu kana munyo muyombo ya nikale. Na wati ongwenda mwikale. Tisawa? Asante ngai na mwathime.
Excellency.
Najua mwizite sibitali. Maundu mege wakuya.
Ano koti ende tano kwa kupita.
Nitakwate ania. Nimwambiwa.
Sasa kidogo tu bewa mtana kuna
in the compound where the doctor used to stay. While in the other sub-counties, IEBC rents buildings out there. But here, they are within the hospital compound. Your Excellency, I would not like to support this as a chairman of Level 4 Hospital. And I would like us to take this one very aggressively. Without siasa, let us serve the patients. Patients feel very happy when they are given an environment like this. And what I have seen today, our patients are in good hands. Asante sana na Mungu awabariki.
Thank you.
Ino ni Mutongoi TV.